Hi, and welcome to the IAPB Eye Health and COVID-19 web series, where we invite experts from across different areas of health and development to discuss key issues during the current pandemic. I'm Jessica Cross-Lawrence, the Head of Policy and Advocacy at the IAPB. Today's interview is a part of a series of discussions to understand the way eye health organisations are responding to challenges in operating during the pandemic and adjusting to normal. I'm delighted to be joined today by Professor Matthew Burton. Professor Burton is the Director of the International Centre for Eye Health at the London School of Hygiene and Tropical Medicine. He holds a Wellcome Trust Senior Research Fellowship and leads a large international research group of clinicians and scientists working to improve eye health in low and middle income countries. He has a particular focus on supporting research capacity development for eye health. Matthew is also currently co-leading the Lancet Global Health Commission on Global Eye Health with Professor Hannah Fowle from Nigeria, which will report in December 2020. He is an honorary consultant ophthalmologist in cornea and external eye disease at Moorfields Eye Hospital. Welcome, Matthew.
Good morning, Jess. Thank you for inviting me.
So, Matthew, we've all had to adapt over the last few months due to COVID-19. What changes has the International Centre for Eye Health made?
So on a day-to-day basis, like many organisations, we've not been able to work in our normal working environment. So we've by and large been working from home. So our team is dispersed not only around the UK, but around the world, people who are part of the team. And so we've moved, as other organisations have, to a very much an online pattern of relating and connecting with each other. So that's how we work as a core team, but also internationally, projects that we're involved in supporting, collaborating with around in different countries, research projects and so forth. A lot of that has been paused, where there's been field work that's inevitably been paused. And also then education has also been profoundly affected. So when COVID hit the United Kingdom, we had to basically stop our face-to-face teaching with our master's students. And as a result, they finished their courses in a virtual environment. And now we're kind of in transition, looking forward to next academic year to delivering that material largely online. So quite a lot of fundamental ways in how we work change.
Thank you, Matthew. And well, I know that COVID-19 has obviously dominated the political, but also the academic and scientific agenda. What do you see as the effect on the research landscape, particularly in eye health?
So I think clearly a lot of stuff has been paused, and that inevitably will set us back. Projects that people have been working on, not just our group, but people from institutions all around the world have had to halt work that they've been working on for a long time. And so it's unclear at the moment, obviously, we don't know when things are going to return to a more normal state of affairs, when that work can recommence. So I think that will set us back as a community. Also, a lot of people have been diverted into supporting the response to COVID in the workplace, and have had their work heavily disrupted as a result of that. And so that also has kind of led into a sort of wider pause, really, in terms of moving eye health forward in terms of the academic side.
And you mentioned obviously the changes that you've made to the teaching program and moving things online. Have there been any other kind of impacts, and what strategies have you adopted to enable that activity to continue?
So in some ways, this has been one of the really positive things that we've learned, because we've had to change and adapt to the situation. We've done things differently. So for example, every year in June, we run a short course, a 1-week short course, usually of around about 15 people who come to London from around the world. And this year, we moved the course online, and instead of having just 15 people, we were able to engage about 40 people together. So that allowed people to reduce costs because people didn't travel, and other things that were able to change, to mean that more people could engage with that. And then going forward, we're looking very much to the next academic year and rebuilding our course online, because we think that most of the students who would normally come to London will not be able to come, at least for the first term. And so the position has been that we will teach everything online and make it available over the internet. And for example, large scale means sort of webinars and seminars that we've been running. We've also been doing a number as well. And that's been a really exciting development. We had one a few weeks ago focused on COVID, the impact of COVID in the ophthalmic workplace. And I think there were over 250 people, mostly from sub-Saharan African countries. That was the primary focus. And lots of people were able to gather and learn together and share their experiences, which is really exciting to see. So I think it has forced us to change in how we connect and relate and how we learn from each other, which I think probably will stick with us for the long term, which will be a good thing.
Yeah, I completely agree. And certainly, as you said, we've had a similar experience with some of the webinars that we've run lately. We've just been able to reach so many more people. And actually, what's been really encouraging is, a lot of the kind of WHO and United Nations sort of programs and events that normally take place in New York and Geneva have all moved online, which has enabled so many more people to engage and influence them, which has been, a really positive outcome from the pandemic. So I hope that does stick with it. So Matthew, you mentioned obviously the COVID webinar that you've run, and I know that you've done a lot more on this topic, and the Journal of Community Eye Health, for example, has recently published a COVID-19 edition. What has been the level of interest and feedback, and are there plans to continue to do more in this area?
So the Journal of Community Eye Health had a special issue on COVID. I think it's gone to the printers this week, and it's been online as each article has become available. It's been put online, and we've seen a very wide uptake of that in terms of who's been accessing and downloading. And we that series of articles has been developed very much as an international collaborative with people from all around the world contributing articles and what they've learned in terms of how they've been able to adapt their practices locally to be able to continue to serve the eye health needs of populations within the current constraints. Very practically orientated series of material, and we think from the feedback we've received so far that that's been really appreciated and been useful to people.
And Matthew, what do you see as the role of the International Centre for Eye Health and similar organisations, but also I guess the role of eye health more generally, both during but also as we recover from the crisis?
So for us specifically, I would say that we're an organisation that's also research and education focused rather than service delivery. So we see ourselves as a place that does feel like a forum where people working in this space can gather and share knowledge. And for example, things like the journal is a good place to bring together lots of people around the world to share their experience and write about it. And similarly, some of these webinars. So I think we see ourselves as being a facilitator and a connector to help to encourage that discourse and shared learning. And I think going forward, I would see that is a growing area. And I think, as we've already touched on, just the realization that actually we can communicate really effectively with sort of large scale webinar type of events, I think is really exciting. I think it's going to be interesting to see how that changes the educational landscape going forward, both for formal talk courses, but also for more informal kind of seminar type series. I think there's quite a buzz around that at the moment. Just talking to colleagues, for example, in the countries that come together under the COEX College of Ophthalmology, Eastern, Central and Southern Africa, they're really moving forward in developing their ideas and planning around delivering education in an online manner. And so I think we're going to see quite a big change in this space going forward.
And finally, Matthew, obviously we're all in the eye health sector extremely excited and pleased that the Lancet is doing their global commission on eye health. I wonder if you could just spend, the last few moments about what you think the outcome and what it hopes to achieve will be from publishing the commission.
So the commission is a collaboration between around about 75 people from around the world. I think last count it's over 25 countries are represented in the commission body. So quite a diverse group of people and geographies and expertise represented. And it's speaking into a large number of areas in relation to eye health, not just about eye health and the epidemiology, but also looking at sort of health economics, the research side, health systems, the health financing and so on. And we hope that it will really complement the excellent work WHO has been doing in the last few years, particularly with the publication of the World Report on Vision, and hopefully provide some additional data and information that people will find helpful in terms of taking forward the agenda for eye health. We've done quite a lot of work underneath the main report in a number of areas. For example, looking at how eye health relates to development in general, and in particular the Sustainable Development Goals, through performing things like systematic reviews and detailed analysis of what we know and what we don't know. And I think going forward, what I hope it will lead to is perhaps in terms of the research side of things, a clearer understanding of what are the boundaries of where we've got to in terms of our understanding. What are the gaps that we need to fill as a global community together to move forward the field. We hope that it will be a really useful piece for advocacy, that it will hopefully be convincing and persuasive in terms of the need to address eye health, not just for its health benefits, but actually for the broader development benefits. And we think that that's going to be one of the really big messages that we want people to get from reading it.
That's great, and we all really look forward to reading it, and I'm sure, I know that it will be a fantastic advocacy tool, particularly in terms of positioning eye health as not just a priority health issue, but also a priority development issue. So that brings us to the end of our interview today. Firstly, I'd just like to thank you, Matthew, for sharing all of your insights with us. And thank you to those who are watching. We hope you found this session useful. As I mentioned, this interview is part of a series of webinars that we're recording on COVID-19, but we also have a number of different resources available on our website and on our social media platforms. So please do come and visit us and watch and read those stories. Thank you.